How many of us are guilty of dismissing warning symptoms of heart disease and attributing them to stress or aging? Do we prioritize our heart health sufficiently, or do we seek medical assistance only when it is too late? In this video, we'll go over 9 warning signals that your heart is in trouble, as well as 9 traditional symptoms of cardiac disorders. Don't overlook the warning signs. Knowledge is power when it comes to heart health. Many people believe that heart problems only affect the elderly or those who have a family history of heart disease. This, however, is not always the case. Heart disorders can occur at any age and sometimes go undiscovered until it is too late. It is critical to remember that cardiac disorders can manifest themselves in a variety of ways, not always in the form of chest pain. To preserve good heart health, be aware of the warning signs and symptoms and take action. Here are 9 visual symptoms of probable cardiac problems to be on the lookout for. Ulcers are open wounds or sores that heal slowly or do not heal at all. Ulcers can be caused by a variety of factors, including infection, disease, and certain medical problems. Ulcers are commonly caused by digestive issues, such as acid reflux, and drugs that irritate the stomach lining, such as aspirin and ibuprofen. If you get ulcers, it is critical that you seek medical assistance since they might be a sign of a more serious underlying health problem. Your doctor can assist you in determining the source of your ulcers and recommending appropriate treatment. Your doctor may give drugs, propose diet changes, or offer other therapies to help encourage healing depending on the cause of your ulcers. Swelling, also known as edema, is a frequent condition in which excess fluid accumulates in the tissues of the body. It can occur everywhere in the body, but the legs, ankles, and feet are the most usually affected. Swelling can be caused by a variety of factors, including injury, pregnancy, and certain medical disorders such as heart failure, liver illness, and kidney difficulties. It's critical to know what to look for when it comes to swelling. Keep an eye out for any changes in the size or form of the affected area, and keep track of whether it grows during the day or shrinks at night. If you have persistent swelling, consult with your doctor to discover the underlying cause and the best course of therapy for you. Cholesterol deposits on the upper eyelid might be an indication of elevated cholesterol levels in the body. These deposits appear as yellowish, elevated plaques surrounding the eye. While xanthelasma is not dangerous, it can be a sign of excessive cholesterol levels, which can increase the risk of heart disease, stroke, and other cardiovascular disorders. The cause of xanthelasma is unknown, however, it is linked to high levels of low-density lipoprotein LDL cholesterol in the blood. Because it can build up in blood arteries and increase the risk of heart disease, this type of cholesterol is usually referred to as bad cholesterol. If you have xanthelasma, you should consult a doctor and have your cholesterol and triglyceride levels checked. Early detection and treatment can help lower your chance of developing heart disease and improve your overall cardiovascular health. Senile arcus is an eye ailment that causes a white or gray ring to grow around the iris. This disorder is more common in elderly people and is linked to aging, excessive cholesterol, and high blood pressure. The cause of senile arcus is unknown, however, it is believed to be related to changes in the blood vessels of the eyes. This can result in the accumulation of cholesterol and other chemicals in the blood vessels, resulting in the creation of a white or gray ring around the iris. It is critical to consult a healthcare expert if you have senile arcus. They will be able to do a physical examination and run tests to establish the root cause of the condition. This can aid in determining whether the senile arcus is associated with a serious health problem such as excessive cholesterol or high blood pressure. Early detection and treatment can help you avoid future health issues and enhance your overall well-being. Cyanosis is a disorder in which the skin and whites of the eyes turn bluish due to a lack of oxygen in the blood. This can happen for a number of reasons, such as heart illness, lung disease, or anemia. If you or someone you know is experiencing cyanosis, it is critical to get medical assistance since it might be a sign of a more serious underlying problem. Cyanosis can be caused by anything from a simple cold to a more serious ailment like a heart attack or pneumonia. Cyanosis can also be caused by congenital cardiac disease, which is present at birth in some cases. Regardless of the cause, seeking medical assistance is critical to determining the underlying problem and ensuring proper treatment. To diagnose the cause of cyanosis, medical professionals will utilize a number of diagnostic techniques, including a physical examination, blood tests, and imaging scans. Depending on the underlying cause, treatment may involve drugs, oxygen therapy, or even surgery in extreme situations. It is critical to be aware of the signs of cyanosis and to get medical assistance if you or someone you know is suffering from it. Individuals suffering with cyanosis can improve their general health if they receive timely and adequate therapy. Hair loss on the legs might be an unexpected sign of a health condition, but it should not be overlooked. Hair loss on the legs can indicate post-circulation and a lack of oxygen in the legs. This can be caused by a variety of medical conditions, including heart disease, diabetes, and peripheral artery disease (PAD). Hello all, if you loved the video, please like and subscribe. It will assist YouTube in reaching more people and raising awareness. Let us now return to the video. Hair loss on the legs can be caused by a lack of blood flow, which can be caused by a variety of causes including smoking, high blood pressure, high cholesterol, and obesity. It is also crucial to know that hair loss on the legs might be caused by age. It is critical to consult a healthcare expert if you are having hair loss on your legs. They will be able to do a physical examination and run tests to establish the root cause of the hair loss. This can help evaluate whether the hair loss is caused by a major medical condition such as heart disease or diabetes. Early detection and treatment can help you avoid additional health issues and enhance your overall well-being. Paleness or a lack of pigment in the skin may indicate an underlying health problem. Paleness can be caused by a variety of factors, including anemia, low blood pressure, and post-circulation. Infections, diseases, and exposure to cold temperatures are some reasons of paleness. If you are pale, it is critical that you seek medical assistance as soon as possible. Your doctor can assist you in determining the reason of your pallor and recommending appropriate treatment. Your doctor may request blood tests, do a physical exam, or send you to a specialist for additional assessment depending on the cause of your paleness. Paleness is typically successfully cured and prevented from reoccurring with quick and adequate medical care. Maintaining excellent cardiovascular health requires early identification and treatment of any heart problems, so keep an eye out for these warning signs. Aside from outward clues, certain traditional symptoms may indicate that you are suffering from cardiac difficulties. Here are some of the symptoms to be on the lookout for. Another common indication of heart difficulties is a rapid or irregular heartbeat, which can indicate an underlying health condition. This symptom can be caused by a variety of reasons, such as heart disease, a heart attack, heart failure, or an arrhythmia. People who have a rapid or irregular pulse may notice their heartbeat is too fast or too slow, or they may notice skipped or additional beats. If you have a rapid or irregular heartbeat, seek medical attention immediately to discover the reason and obtain proper treatment. Fatigue is another common symptom of heart disease, and it can indicate an underlying health condition. Fatigue can be induced by a number of circumstances, including heart disease, a heart attack, heart failure, or other heart and blood vessel disorders. Even after a good night's sleep, those who suffer from fatigue may feel extremely fatigued, exhausted, or weak. If you are experiencing exhaustion, seek medical attention to establish the cause and obtain proper treatment. Nausea or vomiting is a common symptom of heart disease and can indicate an underlying health condition. This symptom can be caused by a variety of conditions, such as heart disease, a heart attack, heart failure, or intestinal issues. People who have nausea or vomiting may feel ill to their stomach or have a strong desire to vomit. If you develop nausea or vomiting, seek medical attention immediately to ascertain the reason and obtain appropriate treatment. Swelling in the belly is a common symptom of heart disease and can indicate an underlying health concern. This symptom can be caused by a variety of conditions, including heart disease, a heart attack, heart failure, or an accumulation of fluid in the belly. People who have abdominal edema may notice their stomach becoming swollen or bloated. If you have abdominal swelling, it is critical that you seek medical assistance to discover the reason and receive proper treatment. Another typical indication of cardiac disorders is shortness of breath, which should not be overlooked. This symptom can be caused by a number of reasons, including heart disease, a heart attack, heart failure, or other heart and lung diseases. People who suffer from shortness of breath may struggle to catch their breath, especially when engaging in vigorous activity. If you have shortness of breath, it is critical that you get medical assistance to discover the cause and receive proper treatment. Chest pain is a common indicator of heart disease, therefore it should be taken seriously. Chest pain is an unpleasant or acute sensation felt in the center of the chest that can be caused by a variety of events such as a heart attack, angina, or cardiac inflammation. Shortness of breath, perspiration, or a sense of tightness in the chest may accompany chest discomfort. If you have chest pain, you should seek medical help right away since it could be an indication of a serious health problem that requires rapid treatment. Dizziness or fainting is a common indication of cardiac problems, thus it is critical to be aware of this symptom. This symptom can be caused by a variety of conditions, such as heart disease, a heart attack, heart failure, or low blood pressure. Dizzy or fainting people may feel unstable, lightheaded, or lose consciousness. If you develop dizziness or fainting, seek medical help right once to ascertain the reason and receive proper treatment. From visual clues like skin color changes to typical symptoms like chest pain and shortness of breath, it's critical to be aware of the warning signals and get medical assistance when necessary. Early detection and treatment of heart issues can have a substantial impact on heart health maintenance. It is impossible to stress the significance of obtaining medical attention. Don't ignore the warning symptoms. Instead, take charge of your heart health and get checked. Remember that heart diseases can affect anyone at any age, so being proactive in protecting your heart is critical. So, what are your feelings on the matter? Please let us know in the comments. Remember to show your appreciation by clicking the like and subscribe buttons. We'll see you in the next video.